Hello, I'm Dr. Juliana Simonetti. I'm a physician who specializes in obesity medicine, and I am the medical director of the Comprehensive Weight Management Program here at the University of Utah. Today, Naleen and I will be talking about Smart to Eat, a medical app designed to help those with excess weight, type 2 diabetes, and hypertension make healthier choices when eating out. First, a quick overview of the problem. Obesity is the second leading cause of preventable death in the U.S., and it affects about 42% of the U.S. population. And it is associated with significant increased risk of type 2 diabetes, hypertension, and cardiovascular disease. A 2017 study calculated the annual impact of obesity from both direct and indirect costs associated with loss of productivity at $1.4 trillion. So any improvement in the American diet can have a significant health and economic benefit. So a large portion of the American diet comes from foods consumed away from home. On average, Americans eat out 5 times per week, some many more than that. And although with the COVID pandemic, dining out has slowed down, the use of food delivery apps such as DoorDash and Uber Eats has accelerated over the last few months. And we do know that foods that are consumed away from home tend to be much higher in calories and much lower in nutritional value compared to those foods cooked at home. People need help in making healthy and smarter choices, and there are many reasons for that. Menu items tend to be deceiving, oftentimes listed as skinny or healthy. Those items tend to have higher contents of sugar, salt, and saturated fats. When restaurants do print the nutritional information, it tends to be in tiny little prints, which makes it difficult to read. And even if you're able to read that information, we then have to translate into making a healthy choice, and many of us have a limited nutritional literacy. In addition, we often tend to make impulsive and poor choices when eating out.
Introducing Smart to Eat. Smart to Eat is an instant and elegant restaurant and menu item evaluation platform driven by obesity medicine specialists and registered dietitians to provide smart recommendations based on the user's specific healthcare needs. Users will select the reason behind making smart choices for them. We will focus initially on type 2 diabetes, hypertension, and weight loss. Smart to Eat returns restaurants ranked on the quality and the number of smart choices available. Individual menu items are ranked as well by how smart the choice is, and also by user reviews. Item level information allows the user to understand why the choice is right for them, as well as to rate the item. Ultimately, the platform will be able to support personalized coaching as well as on-demand support from registered dietitians for an additional fee. Smart to Eat. Find something smart to eat. There is no shortage of weight loss solutions and tools in the marketplace. From support groups such as Weight Watchers to behavior modification apps such as Noom, there are options designed to help a user eat healthfully. However, Smart to Eat is the only solution specifically designed for dining out and is focused on a user's specific health needs. We also believe we can offer the app at a more affordable price point than these other solutions. When we look at some of the top diet and weight loss apps, the pricing model most used is a subscription model, where the user pays a small monthly fee and is offered a reduced rate for a longer commitment. Based on preliminary research interviews with potential customers, we see evidence that consumers would pay somewhere between $5 to $7 a month. As one would expect, the market for health and fitness apps is growing fast. Smart to Eat fits in both the exercise and weight loss and diet and nutrition segments of the market, and combined they are projected to grow to over $3 billion in North America by 2026. As we zero in on the markets we are targeting, we focus on those North American figures. We are initially focusing on serving the 50% of Americans that suffer from type 2 diabetes and hypertension. From there, we make a conservative estimate that around 2% of that group will seek restaurant and menu selection advice. With these conservative assumptions, we think that the market for this type of product could be over 30 million by 2026. Smart eating choices will be decided for each user by an efficient and structured algorithm. The first and most heavily weighted input to the algorithm are dietary restrictions specific to a user's condition. The algorithm compares the restrictions to menu items of nearby restaurants while also examining distance and user reviews, which are less heavily weighted, and returns the restaurants with the highest amount of menu items that meet the user's specific need.
We see Smart to Eat as a platform. Once we're offering exceptional experience to the initial users, we can further expand it to other health conditions. From there, we can also offer services such as health coaching through the app. We also believe that there is a potential in the business market where health systems and insurers could offer it as part of their plan, and companies could offer as a benefit to their employees. So here is a truly diverse team that will work to make this happen. Myself, a experienced strategy and finance executive, a bioengineering undergrad, a med and PhD student, a computer science student, and a registered dietitian. Thank you for this opportunity.